You're entering the world of ancient Egyptian medicine through the Edwin Papyrus, a unique and rare document dating to around 1600 BCE during Egypt's New Kingdom. This papyrus is not just a historical curiosity, it is the oldest known surgical treatise and trauma manual, revealing a surprisingly advanced and systematic approach to injury treatment that challenges many modern assumptions about ancient medicine. The text documents 48 individual cases of injuries focusing mainly on head, neck, and spinal trauma. It offers detailed descriptions of symptoms and signs, a diagnostic method, prognosis predictions, and treatment advice. You're looking at a medical document where logic and observation reign over superstition. The papyrus was found by Egyptologist Edwin Smith in the 19th century and translated primarily by James Henry Breasted in the early 20th century, who recognized its value as a scientific document rather than purely magical incantations. One remarkable feature is its classification of cases as favorable, uncertain, or hopeless, an early form of triage and prognosis rarely seen in ancient sources. For example, cases involving spinal injuries describe paralysis and loss of sensation meticulously, indicating awareness of the central nervous system's role. You imagine yourself as an ancient physician reading these cases, noting how certain injuries were treated conservatively, rest and bandaging, while others received recommendations for surgical interventions. The papyrus even cautions about when to treat and when to admit defeat, underscoring a realistic medical philosophy. It emphasizes cleanliness and detailed observation, highlighting the Egyptians' clinical sense. Hypothesis 1. The Edwin Smith Papyrus influenced later Greek medicine, directly or indirectly, sharing knowledge about trauma care. Hypothesis 2. The Egyptian manual was likely used by medically trained priests or battlefield surgeons, showing Egypt's advanced medical infrastructure. Halfway through, you envision standing in a temple clinic where a patient with a crushed shoulder waits. You open the papyrus and read the precise instructions for assessment and treatment. The physician's rational approach contrasts with the mystical healing rites you expected. The papyrus is also notable for discussing the brain with surprising sophistication, describing symptoms of brain trauma and linking them to specific functional deficits, a remarkable early neuroscience insight. This contradicts myths that ancient cultures had no concept of brain function. What still puzzles scholars is the original author's identity and how the text was transmitted unchanged for centuries. Also, we debate how widely this knowledge was applied beyond elite practitioners. You leave with a deeper understanding of how advanced ancient Egyptian trauma surgery was, taught through concrete cases recorded in the papyrus. Now it's your turn. How do you think this challenges modern views of ancient medicine? We read every comment and can't wait to hear your thoughts. Don't forget to subscribe for more history deep dives and the full explanation of each case from the Edwin Smith Papyrus on the channel. Join us and explore the roots of evidence-based medicine.